This tutorial will briefly describe how to estimate pleural effusion volumes using ultrasound. The current literature describing how to estimate pleural effusion volumes have been performed in patients in the ICU who were in the supine position and mechanically ventilated. However, we can use the same measurements and calculations to estimate pleural effusions in any patient. First, to make the diagnosis of a pleural effusion, you want to place the probe marker in the coronal plane with the probe indicator pointing up towards the patient's head. Here you will look in the left upper quadrant and the right upper quadrant to assess for the presence or absence of a pleural effusion. If you do detect a pleural effusion, you turn the probe 90 degrees in the transverse plane with the probe marker pointing up towards the ceiling. And in this transverse plane, we're going to measure the PLD. The PLD is the distance between the posterior chest wall and the lung base. And this PLD is what we will use in our calculations to estimate pleural effusion volumes in our patients. One study showed that if you measure the PLD to be greater than 50 millimeters, then the predicted volume will likely be greater than 500 mLs. And below you see the following test characteristics of this study. Another study tried to replicate this, and they showed that the pleural effusions will likely be greater than 800 ml if the PLD is greater than 45 millimeters on the right or greater than 50 millimeters on the left, with the following test characteristics. If you want to be a little bit more specific, you can use this equation here, which will give you the volume, which is equal to 20 times the PLD. However, this equation only works if the PLD is at least 10 millimeters. So, for example, if you measure the PLD to be 15 millimeters, the volume will be 20 times 15, which will give you a volume of approximately 300 mLs. So to briefly review, to make the diagnosis of a pleural effusion, you want to look in the coronal plane. If you identify a pleural effusion, turn the probe 90 degrees in the transverse plane to measure the PLD, which is the distance between the posterior chest wall and the lung base. One study showed that if this PLD is greater than 50 millimeters, then the volume is likely going to be greater than 500 mLs. Another study showed that the volume will be greater than 800 mLs if the PLD is greater than 45 millimeters on the right or 50 millimeters on the left. And to be a little bit more specific with your calculation, if the PLD is at least 10 millimeters, you will have a volume which is equal to 20 times the PLD. Please visit our website, and if you have any questions, please feel free to email us at any time. Thank you.